Perfect. So today we're going to be doing a few palpations on Logan. So kind of beginning with palpations, one thing we want to make sure we start with is that we have their consent. We want to use basically the pads of our fingers and palms and not our fingertips. Start with light pressure to apply and work our way up, making sure that they know exactly where we're going to start and finish. So first muscle I have is the biceps brachii. So we'll go ahead and start distally here on this right arm at the insertion point here at that bicipital aponeurosis. So if you go ahead and have them flex their bicep right here, you can get that tendon to poke, so we can palpate right here and go ahead and relax on that tendon, work our way up into the muscle belly. So you have the short head comes up here to the coracoid process, and then the long head, which goes to that glenohumeral tubercle or subglenohumeral tubercle. So with that, you can work your way starting distally from that insertion tendon up and pinch both muscle bellies. And if you're struggling with that, you can have them flex their bicep and hook underneath for that long and short head, working all the way up in. Next, we have the flexor carpi ulnaris. So what we can have them do, starting here on this medial epicondyle, they're going to go ahead and flex, and then they're going to ulnar deviate, and that should get that to pop here. You can see that muscle belly come out. So follow that from that medial epicondyle of the origin. Go ahead and relax. And it's going to come all the way down and insert here onto the pisiform and the hook of the hamate. So with that flexion, you can start to feel that muscle belly again, working from that epicondyle. This time we can go proximal to distal. Is a little bit easier to palpate on that. Next, we're going to do the anterior, looks like ASIS, so anterior superior iliac spine. So if you have their consent to go ahead and expose, sometimes it's a little bit difficult with shorts, so it's either easier to come with that band up or down, so we'll go ahead and go up. And with that, you're just looking to find the ilium, and that ASIS is going to be the most anterior protuberance coming out. So best way to do that is to kind of go below, apply a little bit of pressure, and then hook underneath with your thumbs. So your ASIS right here on Logan. And then if you were to come down and be able to expose right about here at the line of his underwear would be your ASIS. Next, we'll go ahead and do the insertion of the gracilis. So that's going to be the pes anserine. So if you bring them into kind of passive flexion here, you can get these tendons to pop through for the 3, and then coming into your gracilis is going to be right here on that pes anserine. So you feel that little bit of a bony protuberance, and you can also feel the other muscle bellies coming in from semi-mem and semi-ten. Next, we're going to do friction massage on the right lateral epicondyle. So we'll go ahead and have them start here, just so you can identify. We're starting out here on that lateral aspect, right elbow. So if we want, we can have them put a little bit of stretch here. And then with the friction massage, what we're trying to do essentially is bring a little bit of blood flow and kind of warm that tissue up. This is a good pre-event. It can be post-event. We don't want to have any ointment or lotion on there. It gets a little bit slippery. And so with that, there's not a whole lot of pressure that we really need to apply. We just want to make sure that the skin isn't sliding underneath us. So a little bit of pressure here on that lateral epicondyle. And you can begin, again, you can support your thumb and just kind of work the tendon back and forth. So here again, we're just bringing blood flow to that area, breaking up any adhesions or anything that we might be seeing in that site of that lateral epicondyle. So yeah, for this, I mean, it's really brief treatment time, about a minute or so is all that we're looking for here. So yeah, with that, we're just trying to break up any adhesions that we might see, give them a little bit of relief. Next last, we'll do rhythmic compression of lumbar. So if I can go ahead and have you flip over onto your stomach. So with this, we're going to identify our lumbar spine here, and with this rhythmic compression, basically what we're going to do is just be pushing these lumbar spines or vertebrae down into the underlying muscle belly. So best way we can kind of do is come up here just above that sacrum, and we can just apply pressure and release. Spread out and apply and release. It's not a whole lot of pressure. It doesn't need to be, especially if it's not really dense muscle tissue in the lumbar spine. So we're just going to go ahead and apply pressure, release, apply, release. Good there. So last, we're going to go ahead and have you flip onto your side. So we're going to do a broad plane shift of the IT band. So what we can do, if we have a bolster, something that we can slide under here, hopefully just give them a little more stable. So you're kind of just going to get a feel and for the attitude of the tissue with the IT. So using both hands, applying just enough pressure to get down through that skin. You're going to kind of work the skin each direction, first proximally and distally, and find where you have your adhesion. And then once you've identified your adhesion, So let's say he's a little bit tight coming down distally. We're going to pull into that and hold. And basically what we're trying to do is just get that tissue that myofascial tissue to release. And with this technique, especially on the IT band, with just the way the fibers orient, we're going to want to do, I guess, dorsal and ventral, or anterior posterior, and then a little bit of this lateral component as well, diagonal up and down. Again, just trying to find where the tissue is the most stuck, or where the most adhesions apply. You'll kind of feel that in the tightness. So again, once we get to that point, pulling it against and holding and waiting for that to release, and repeat multiple times. Yeah, that should do it.